Well, hello. Today's training is from Free and One Training Institute, and I'm Dr. Simmons. I will be your facilitator for today. Our topic today is understanding principles and guidelines for trauma informed care. Understanding trauma informed care. What is trauma informed care? Trauma informed care is a name that reflects its core principles, acknowledging and responding to the impact of trauma on a person's life. It emphasizes understanding that trauma can affect anybody. It could be anybody that has trauma in their lives, and we all have trauma. But it takes the approach that's from what's wrong and what happened to how we can make the individual strong. Trauma can be life changing experiences, and it can happen to anybody at any age. And so we want these traumas they can go from generation to generation. And we want to have trauma informed care. We want to make sure that we provide care to those who need it appropriately. And that's why we want to understand. Examples of trauma in our lives today. Definitely homelessness, accidents, job loss, a loss or separation of loved ones. And that could impact our lives today, as many people may be separated from loved ones due to more reasons than separation from death or divorce, but it could be a person that's a citizen or not a citizen. They could be separated from their loved ones. Early childhood trauma, and some of that could make childhood traumas, violation of mind and body, and childhood abuse. Trauma is an emotional response, and that emotional response can be physical, it could be emotional trauma, and it could be a psychological trauma, and it affects everyone. Trauma can affect everyone. We want to see how do we address the trauma that can be affected in our lives and the people that we work with in our industry. A lot of us work in social service environment. You don't have to be a therapist, but you can be in an environment that you service other people if a nonprofit organization. And some of the people that you might service may have experienced some of this trauma, and it's drama too. But we have to realize, recognize, and respond. Realize that people have different dramatic experiences because it's all individually. So don't take it personal. Avoid taking it personal. Try not to be offended when somebody don't know how to respond to you because of the trauma that they've been faced with. But recognize and respond to the signs and symptoms that they may have. And many clients have adverse childhood experiences and a toxic stress. And this childhood experience could be part of how they operate as adults. So we have to recognize that trauma could be in 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 representation of what happened as a child. So make sure that you understand that it's not personal, but realize and recognize and respond. And how do you respond? You don't have to be the therapist. You don't have to be psychiatrist, but you can respond by obtaining resources and getting the training and the knowledge so that you can identify it when you see it, and you don't re-traumatize somebody else. So understand that many of us go through traumas, and if you have the training that's necessary, then you understand how to operate. And that's what we want to talk about today, understanding how to operate during these times, because hurting people hurt people. Hurting people hurt people, and that is not our goal. We don't want to hurt people. Instead, we want to be in service. We need to be of service to help other people, help them get through some of the problems that they may have in their lives, and to create a healing environment for them. Well, there's five principles that we want to discuss in this presentation today. It's number one, safety, trust. Number two is trustworthy and transparent. Number three is choice or voice. Number four is collaboration and empowerment. And that's what we want to discuss. We're going to discuss these principles that create healing environment, and it doesn't trigger re-traumatization. If you follow these 5 principles, it can be very helpful in your service. So let's discuss safety. With safety, just provide to the person or persons a warm environment, a support for the individual to feel safe. Don't stand over them. Don't get too close if it's a person that you've just met, but create a warming environment for them and let them know that trustworthy and be transparent. Meaning, how do you show being transparent? You can show the operations, and you can be transparent on the goals and the trust of the staff and family member receiving services. You develop that, and the way you develop it is maybe you can explain the rules. You don't just explain the rules of why do you do what you do, but I mean, you don't just tell them the rules, but you explain the rules so that they will understand what you do, why you do it, because that means you're transparent. You can say, well, our rules today would be that we don't have candles in the rooms. We don't have candles on our property. And the reason why we don't have candles is instead of just being so dogmatic with, we don't allow candles. We don't allow candles. No, that's not being trustworthy and transparent. Or letting them know that if there's anything you could do to help them make that transition from wherever they came from to you and whatever reason they came from you, just be a little easy on them. Have empathy for their situation. Understand that it may have been something that they could not handle when it came upon them. Let them have a voice, a choice. Provide an individual with a voice to be heard. In other words, you can do what we call a motivational interview, and you can ask a question or open-ended question what they would have to answer. You can say, well, what do you think about this? How do you feel about this? Or what is your history? Where have you been? Is this something that would accommodate you? And then they can say, yes, I can work with it, or I cannot work with it. Let them participate, and then they become, on the next part, number 4 is collaborative. You are showing collaborative relationship, which helps them feel that they're part of the decision making. And when I say collaborative relationship, you can find out from them, will this work for you? Can this be a place that you will feel comfortable maybe living or staying or even seeking the services? If they're seeking services, if it's a substance abuse service or a shelter service, a homeless shelter, whatever type of service they're seeking from you, you show that you're a team player and you're listening to their voice. You're participating. They're participating. They have a voice to show that they understand because you've explained it to them. And so the organization is doing its best to not to have judgment against somebody, but more empathy. And that's why you give them a choice, you collaborate with them as a team. After all, it's their life. It's their life, so don't be such a dogmatic leader that make them feel inferior to their circumstance. They may already have low self-esteem and bring a lot of other baggage with them that they haven't worked out yet. So you don't want to do anything to harm. So this is number 3 and 4. Number 5 is empowerment. Your goal is to strengthen your staff, your family members, and to recognize that everybody is unique and requires individual approach. Build on the clients that you serve, your staff, your community, rather than the deficit and not empowering people to be the best that they can be. So you have to make sure that you empower people, that you build on their strength, that you use a person first language, meaning that you say, what do you feel? And you talk to them, not over them, not making them feel less than because of their situation or their circumstances. So it's very important that you don't have where they are being traumatized again after and again and again. You have to make sure that you understand what their needs are individually, in an individualized approach. is necessary. So as I recap, I want you to know that the first part is safety, providing them a safe environment. The second one we discussed was trustworthiness and transparency. Provide clear expectations of what you would have them. Inform them what is necessary for them to either work in the house or stay in the house or work in the organization or stay in the organization. So inform them about the options available in their choices and collaborate with them. Share the power that they seek, that you will seek ideas and their feedback on what would make them more comfortable, and acknowledge them as individuals. And then the last one we talked about is empowerment. Build on their strength and their capabilities, and yours too. Build on yours, that you yourself will be able to service the community. So we have to understand that there's some interchildhood traumas that may show up because healing takes time. Childhood traumas can show up in adults with the feelings of guilt, abandonment, anger, low self esteem, emotional shifts, or even trust issues. So just be patient with the person, be patient with them. Acknowledge that they may be going through something, or they may even communicate that they may not even never communicate what happened as a child because they may be so traumatized by it, and that's okay. Like I said, you're not the therapist, you're not the one to peel the onion to make them cry. You're just there to find out how you can support them to get to the next level. Not what happened, not how it happened, but what can you do to support them? You know, they can try meditation, they can try prayer, they can try writing the things that make them happy. They can write a letter, they can have collaboration with you, they can do volunteer work, they can do several things. They can also be referred to a therapist if that's what they need, but make sure it's all individualized because we don't want to re traumatize anyone. So, in closing, our goal is to help others. Let's work as a team to be successful in helping others. And here's some resources. It's on the screen, the resources that's available for you if you need to, and if you work with a homeless population. And they also have the National Center on Family Homelessness have a toolkit, an actual booklet that help with trauma-informed care, and you can order a booklet. I don't think it's any cost. Oh, you can download it. I definitely know you can download it for free. So make sure you get some resources that will equip you to do a better job in serving our community. So I want to my name is Dr. Yolonda Young Simmons. I want to encourage each and every one of you to know that God uses ordinary people to do extraordinary things, and you may be the one that's going to do something extraordinary. So just step out on faith and make it happen. Have a great day. Thank you for letting me be of service to you today.